Hello friends, I am Dr. Amol Pathak. I am the Assistant Professor in Department of Practice of Medicine in Jawaharlal Nehru Homeopathic Medical College, Parul University. Today I have made a video about an important clinical topic which is heart sounds. So today I am going to discuss with you heart sounds. So let us first start with what is heart sounds. Heart sounds are those sounds which are generated because of the various activities occurring inside the heart. That means the flow of blood, the closure and the openings of the heart valves. So these activities results into the heart sounds, production of the heart sounds. Now these heart sounds are broadly classified into different types. Say for example, normal heart sounds, extra heart sounds and the cardiac murmurs. Let us first discuss about normal heart sounds. Normal heart sounds are produced as a result of closure of the atrioventricular valves and the semilunar valves. Now what is atrioventricular valves? There is presence of two atrioventricular valves in the heart. One valve is present in between the left atrium and the left ventricle. The name of this valve is mitral valve. Whereas the another atrioventricular valve is present in between right atrium and right ventricle and it is named as tricuspid valve. The other valves are present in the arteries which are originating from the ventricles. From left ventricle there is origin of the aorta and from the right ventricle there is origin of the pulmonary artery. At the origin of these two blood vessels there is presence of semilunar valves which are also named as aortic valve and pulmonary valve respectively. So whenever these valves get closed, they produce a sound on closure and which generates the normal heart sounds. Normal heart sounds are broadly differentiated into two, S1 and S2, which are popularly known as lub and dub. So let us first discuss about the S1 heart sound, that is lub. S1 heart sound is produced because of the closure of the atrioventricular valves. That means the mitral valve and the tricuspid valve. When these valves get closed, it produces a sound that is S1 or lub. S2, that is second heart sound, which is popularly known as dub, is produced because of the closure of the semilunar valves, or it is produced because of the closure of aortic valve and the pulmonary valve. Okay. So S1 and S2 occurring because of the closure of the valves. If we discuss the characteristics about these sounds, S1 is louder in intensity as compared to S2. S2 have two more sounds, two more components which are aortic component and pulmonary component. Okay. But just remember, S2 is produced because of closure of the semilunar valves. Now coming to the other extra heart sounds. Extra heart sounds, there is presence of two extra heart sounds, S3 and S4. These normal heart sounds, you will auscultate them in all the normal healthy individuals. These extra heart sounds, S3 and S4, are not always physiological. Say for example, S3, it is physiological in athletes, during pregnancy and in some children. If suppose you auscultate S3 in any age group other than this, then it can be pathological. Remember, S4 is always pathological. S4 occurs in various heart conditions, heart diseases like systemic hypertension, and left ventricular hypertrophy. It can also be auscultated in case of myocardial infarctions. So remember, S1, S2, they are normal and are auscultated in all individuals, whereas S3 and S4, they are pathological. S3 is physiological only in pregnant ladies, children, and athletes. Coming to the next heart sound, which is called as murmurs. Murmurs are always pathological. Murmurs are again differentiated into two different types, systolic murmurs and diastolic murmurs. We will come to these murmurs later on, or I will make another video on murmurs. Let us first discuss about the normal and extra heart sounds. Now before we proceed to these heart sounds, let me demonstrate you normal and extra heart sounds. So, say for example, I am going to make these sounds. This one first, which is louder in intensity. This is S1 or low. Second, which is less in intensity, it is the second heart sound, which is dub. So when you auscultate the chest wall, you should listen to heart sounds will be auscultated in this way. These are the normal heart sounds. S3 is always closer to the S2 sound. Whereas S4 is closest to the S1 sound. That means now try to understand the differences between S3 and S4. First, this is S1, S2. In S3, but in S4, okay. So these differences you will come to know by auscultation of the chest wall. Now, how to auscultate the chest wall for the heart sounds? What is the procedure? Now, whenever you are supposed to auscultate any patients for the heart sounds, always remember that the chest should be open and you have to auscultate on 4 different areas on the chest wall. So, which are those areas? The areas are pulmonary area, aortic area, mitral area, and tricuspid area. These 4 areas resembles with the 4 valves: pulmonary area for pulmonary valve, aortic area, aortic valve, mitral area, mitral valve, and tricuspid area for tricuspid valve. Now, what are the locations of these areas? Pulmonary area is located on left upper sternal border in the second intercostal space. Remember this, left upper sternal border in second intercostal space. Aortic area, it is located on right upper sternal border, second intercostal space. Mitral area, it is present at apex. That means 5th or 6th intercostal space, mid-clavicular line. I repeat, 5th or 6th intercostal space, mid-clavicular line on the left side. Whereas the tricuspid area is located on left lower sternal border in 4th intercostal space. So these are the 4 areas you must have to auscultate so as to listen to heart sounds. Pulmonary area, aortic area, mitral area,